3rd, 2023. It is our first surgery of the new year here at Duke Spine Institute. Our patient is suffering with back pain. She's had it for many years. How many years? Dr. Duke here. But how about the back pain? Any idea? All right. All right. This is Dr. Duke. We're going to get started, okay? All right. So I'm going to give her a little bit of local to numb things up. She may not like this too much, but anytime you inject medicine under the skin, it's a bit uncomfortable. We try to make it as comfortable as possible. Now she has 3 herniated discs, L2-3, L3-4, L4-5, and I believe these discs are the cause of her leg symptoms. She's got left leg pain. 10 cc's injected. You can see on the MRI scan she's got some bulging discs. We're going to go in there and we're going to take care of those discs. Now I don't know that I can get all these discs with one incision because her spine is straightened out. It's not curved naturally. It's the way it's supposed to. Over the years it's straightened out. So I'm going to do my very best. Let me know if it's uncomfortable, okay? And I'll give you some more medicine. Now we're using our X-ray machine, which you can see over there on the side view. Shot. And so Jordan, I'm seeing L4-5 right there, kind of in front of the needle. You agree? You agree? Yes. Man, she's perfect. Whatever you're doing, doctor. I love it. Shot. So today we have 3 surgeries. We have shot, 2 Duke laser disc repairs, shot, and 1 Duke plasma rhizotomy. Well, her spine is very far backwards towards me, towards this area, which is nice. Those are my favorite because they're easier to do. Shot. That looks good. Give me an AP. So there's 2 types of spines. There's those spines that are anterior or towards the belly button. They're deeper, way down in the body. And then there are the spines that are very superficial towards the back. Oh, it looks so good. It's got some scoliosis. You all see that? Henry, you see this curvature of the spine?
Yes, we do.
Now we're going to fix her leg pain and her back pain. And we're not going to do anything with the curvature. That's because scoliosis itself doesn't cause any problems. All right. But for her, her primary problem is pinched nerves. Shot. And I'm going to go in there and unpinch those nerves. I can feel the herniation right there. Shot. So show the herniation. You can actually see it on the x-ray. You can see a blush, like a dark color right there. Yeah, that's it. I'm actually touching it with the tip of my needle. So that's the back of the disc now. Now, where is the back of the disc supposed to be? Right where the white arrow is. Jordan's showing you. But it's not there. It's actually where the needle is. So it's bulging out and hitting the nerve going down her left leg. We're going to fix that today. So that's one. Now we have to access the next one. And the next one is probably going to be the L3-4 because that right there was the L4-5. I make a 7mm incision. So the whole surgery is amazing. It's done through a tiny little 1/4 inch incision. All right, heading off to the next one. And once again, her spine is so far posterior. It's so easy to get to. Those are my favorite cases. But you have to be careful. You don't want to shot. You don't want to end up going too anterior. Shot to the spine. So I can feel the facet. Shot. Yep, right there. I'm at the facet. Shot. I'm passing the facet. Give me an AP. I don't know if I can get that last disc. You can see the L2-3 disc, the one above where I'm approaching now. Yeah, it's good, thank you. The next one up is kind of further away, so I don't think I can get it through the same incision. I'm going to have to make a second incision, which is fine. It's not uncommon. Shot. Shot. All right, AP. So I want to double check where I'm at. I can feel the disc herniation with the needle tip on the left side there. That's right. Looking good. If you have questions during the surgery, feel free to ask me. I'll do my best to answer them. But we do live stream so that you can ask questions.
We have no current questions, but we do have a comment from SPX730 on YouTube. And they commented, Happy New Year, guys.
Happy New Year, SPX. Thanks for commenting. Appreciate that. It should be a good year this year. We have a lot of backs to fix. You can see the needle is going in. It's pretty collapsed disc space. A lot of people ask me this question, Dr. Duke, if the disc space is collapsed and you're going in and repairing the tear, how are you refilling the disc space? We don't refill the disc space. It's not necessary. And I don't recommend you try to do it. People have tried to do that for years. It doesn't work. Excuse me, all the material you put in there is going to squeeze out because it's under so much pressure. And you don't need it. The goal is to be fully functional with no pain, right? So if I can get you fully functional with no pain, why do you, and without putting jelly in there, why do you need it? You don't. A lot of people are misled to believe that they need that space, but they don't. It's not bad. Let's see, shot. So right now we're trying to get into that L2-3 disc space. You can see it up there. You're doing great, lay still. Shot. She's doing amazing. She hasn't moved at all. She's really comfortable. Shot. I'm just taking my time to make sure we get this done right. Shot. Shot. I feel the facet right there. I'm going to wrap around it. Shot. Yep. Shot. Let's get an AP. Sorry. You can see we've lost 1 drop of blood, literally 1 drop. And these surgeries are pretty much bloodless. That looks perfect. Wonderful. 12, L1, L2, L3. You can see the ribs of T12, then the next one down is this transverse process of L1. All right, we are there. Just going to enter this disc space and we'll be ready to have her do her discogram in just a moment. Doctor? All right. So, for those of you watching here, I want you to understand so far what we've done. The first step of the surgery is to place the spinal needles into the discs right where the herniation occurs. And that way we're not damaging any of the normal parts of the spine that are necessary for stability. Okay, she's literally lost 2 drops of blood the whole surgery. Now, the bottom disc, L5S1, that disc is fine. We're not treating that. Okay, we're not dealing with the L5S1. But just above that is the L45, and that's one of the problem discs. The L45 disc in the back has a tear in the wall called an annular tear. Annular tear. And through that tear, the jelly has pushed out, and we have what's called a herniation. That's the jelly pushed out through the tear. It's the jelly in the tear and outside the tear. And that's affecting the nerves going down her leg. It's pressing on them. Same thing at L3-4, and same thing at L2-3. All right? Now, she's primarily got leg pain on the left side. That's what our main purpose of being here is. But she's also got back pain. And a lot of people, they modify their behavior. They take it easy in life so they don't aggravate the back pain. But that's no way to live life. All right, well, this is going to be the L3-4. She ready? Are you awake?
Friend, are you okay? She said yes.
Are you having any pain?
Are you having any pain anywhere? Any pain anywhere? Any pain? No? Okay.
All right. How bad is that on a scale of 1 to 10?
0 to 10.
What's the highest it goes? What's the highest it goes?
What's the number?
What's the highest?
Huh?
What's the highest it goes?
9, you said? Or 10?
9, 10? Probably, we always go with the highest number. So it's a 10. Is that where you get your back pain? Is that where you get your pain? All right, so it's concordant. So basically, we just tested the first of the 3 discs to see if it was causing the pain that she gets in her back. And the answer is yes, it is. And as I was injecting the dye, I didn't tell her I was injecting, so she has no idea I'm injecting. She doesn't know when that's going to happen. But then she started saying, ow, ow, ow. That means she's having pain. And that's a test. The discogram is the best test there is. Are you okay now? All right. It's better now? Discogram is the best test in the world to see if a disc is causing pain. How bad is that on a scale of 1 to 10? How high did it go? How high did it go? What's the highest it went? I heard 10.
10.
Is that where you get your back pain?
Is that the same spot you get your back pain? Yeah.
All right. So it's concordant. So we have 10 out of 10 at L2-3, 10 out of 10 at L3-4, both concordant. Concordant means that that is the pain she typically gets every day. So when people have a painful joint, like a disc that's injured, what they typically do is they take it easy. They don't do much because they don't want to set it off. You all right? We're almost done. We're going to put you to sleep soon. Everything is going very well. Are you comfortable?
Yes.
All right. How bad is that on a scale of 1 to 10? I hear her saying, ow, ow, ow. How bad is it? Jordan, will you show the audience the herniated discs?
Huh? 8.
The highest it went is 8? No, down at the bottom. See the double little arrow? Those are herniated discs, folks. Can you see that, Henry?
Yes, we do.
So basically, the biggest herniation to me is at L4-5, right where Jordan is showing you. Jordan, will you just take one more picture a little further south just to confirm there's a 5-1 disc below us that we're not treating? All right. Henry, let's show our audience thank you. Show them the 5-1 disc, Jordan. Henry, that's the 5-1 disc. Show our audience, why do herniated discs actually cause back pain? What's the mechanism?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Coming back in 3, 2, 1.
Welcome back. We're now entering the L4-5 disc space. I have the guide wire here, and the dilator is sliding down the guide wire. Shot. I've pulled the guide wire back just a little bit. Shot, because the guide wire is up against the front of the disc space. Shot. Now, I want to get this dilator tip a little bit further, somewhere around halfway to almost like 2/3 is really the best. Now we're putting the tube over this dilator. Shot. And I'm going to advance the tube into the disc space. Now remember, the tube is going through the tear where the herniation is, in the back of the disc. It's kind of a nice situation because all other types of spine surgery are destructive to the spine, to the normal parts of the spine. Shot? Perfect. What do I mean by that? Well, this approach, where we're coming from the side, we're going through a natural opening that's already there. We're not removing bone or ligament or any of the joints in the spine to get into the disc. We're going around the spine. And because of that, we don't create any collateral damage to the spine. So we're not destabilizing it. All other types of spine surgery, laminectomy, discectomy, microdiscectomy, anything else, fusion, artificial discs, all those other surgeries cause damage to your body in order to fix your spine. And that damage is manifested afterwards as pain. And that's why patients need so much painkillers after regular spine surgery, because the surgeon is hurting their body, the patient's body. And with the Duke laser disc repair, there's a herniation. We're not hurting the patient's body. The only harm we're doing is the cut in the skin. And once you get past the cut in the skin, the rest of the surgery is basically harmless. And because it's harmless, there's no need for painkillers afterwards. Look at these herniations. Let's show the herniation.
Lights on, please.
Turn on here, Henry. Look at the size of this herniation. This is what was sticking out. I showed you earlier, Jordan was showing you. It was pushing out through the tear in the back of the disc. Yeah, and you can see the size of it is over a centimeter long. You guys see that?
Yes,
and
we
that's
do.
the second one. We took another one out just as big earlier. Put it up here. Yeah, and so right now all I'm doing is grabbing out these pieces of herniation that were sticking out at L4-5 on the left side. Okay? So the beauty of this surgery is we're literally entering the part of the spine that's damaged right where it's damaged. So we're not causing any new damage to the spine. And that's why patients do so well with the surgery. They don't need painkillers afterwards. They take Tylenol, maybe a couple of Tylenol, that's it. And maybe a muscle relaxer. But most of them don't take any pain meds. Now, when you go have a laminectomy done, or a fusion done, or an artificial disc, you're going to be on painkillers for months. And the reason is all the damage done to your body by the surgeon during the surgery. Okay? A lot of people don't know that, but they should know that. All right. Let's get this done. We're bringing the laser in at this point. And we're now at the bottom of the tube. We're inside the herniated disc. We're inside the tear, the annular tear. You can see it right there. And I'm going to use this laser to debride. It's called the annular debridement. That's the cornerstone of the Duke laser disc repair. That's what sets the Duke laser disc repair apart from all other spine surgeries. We're the only ones that do an annular debridement. And what we're debriding is the herniation inside the annular tear. A lot of people don't realize that there's two parts to the herniation. The part that sticks out where the nerve is in the foramen or epidural space, and the part that is stuck inside the annular tear. That's the bulge part. When you hear of a disc bulge. There's another piece of herniation. Good job, Luis. All right, any questions from our audience?
Yes, we have a question from Carl on Facebook.
Hi, Carl.
And they
Happy New Year.
Happy New Year, Carl. And they ask, what if the pain is in both legs but more on the left? Does
Wait.
this... Sorry.
Go ahead.
What if the pain is in both legs but more on the left? Does this procedure get both sides?
Yes. Yes, Carl. We would go on both sides. We would have to enter your back on both sides. One entry point on the right and one entry point on the left. So with the cervical spine, the neck, I can get both sides with one incision. But with the lower back and the thoracic, I have to go on both sides. Great question. There's a piece of herniation, another one. We've already taken out many. We've already taken out about, I don't know, about 7 or 8.
How's that floor look like?
Here you go.
That floor is okay?
So remember I told you guys before that when you have a herniated disc, it's not one herniation, it's many. And thank you, Oscar. What happens is once you've damaged or compromised the annulus with the tear, now you have a weak point. And you can have many herniations coming out of that weak point. There's another piece of herniation. So she's had these tears for probably 20, 30 years at least, if I had to guess, based on what the MRI looks like and what I'm seeing in here. But she's herniated probably 20 times at each disc, and those 20 herniations have different ages. She may have herniated the first time 20 years ago, and then herniated again 15 years ago, and so on and so forth. So that when you add up all the herniations over the years, there is probably 20 herniations. Every time she had back pain come on again, she had another herniation. All right, Henry, let's show our audience how does the Duke laser disc repair actually work.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, Submit your MRI for a free review at www.mri.dukespine.com.
Welcome back. I'm Dr. Duke Majan, and we're still working on that L4-5 disc through the left side. This is all old herniation right here. You can see the white stuff and the gold. See, the gold color is calcium. The only way you get calcium in a herniation is if it's been there for a long time, like hers. So we call it dystrophic calcification. And it's actually quite common in these surgeries. We see a lot of it because people actually live with their herniations for 10, 20, 30, 40 years. Any questions from our audience?
No current questions, but we do have a comment from John on YouTube, and he has said that he has surgery coming up soon with us, and he's doing great, and he wants to recommend, and I'll recommend you to anybody. He said, "Thank you to give me my normal life back. God bless you."
You're welcome, and we are very excited for you. Anytime I can save someone from having an highly invasive spine surgery that's going to cause damage to their body and more surgery in the future, it's always a good thing.
Oh, I apologize. He's not having an upcoming surgery. He just replied and he said he did have surgery this past July. Forgive me. Yes. And
that's all right.
Yes. And he
Well,
thanks
thank
you for
you.
giving his life back.
Thank you for sharing your story with us and our viewers. We get a lot of viewers, they say, hey, I'd like to talk to somebody who's had the Duke laser disc repair done. And of course, because of HIPAA and patient protection laws, we would never disclose any of our patients to anyone else out there, but patients are always welcome to share their story themselves. How are we doing on irrigation? Because it looks like it's okay. Just about done at this disc. Yeah, all right, good. All right. I'm just about done here at L4-5. See this scar tissue right here I'm blasting with the laser? This is old stuff. As opposed to the blue stuff, which is very young. This is old grungy stuff. This has been inflammation going on for many years from damage to the disc. Remember, whenever your body is damaged, your body responds by inflammation. So ongoing damage that just keeps, it's kind of like a war, an area that's been involved in war for many years. You look at that area and the buildings are all destroyed, the land is destroyed, there's nothing there, you know? It's just ruin. And that's what we see here. We're seeing this disc just has evidence of destruction and damage going on for many years. All right, we're done.
Lights on, please. Thank you.
Let's do a little irrigation. So sometimes patients have allergies to antibiotics and they can't tolerate any kind of antibiotic. And those patients, we don't want to give them IV antibiotics because they could have an allergic reaction that could be life-threatening. So instead we give them this betadine, which is topical, and it contains iodine, developed by NASA to fight any kind of potential infection. And so it's used in surgery. All right. So that's our first disc is done. Now we're going to focus on the next one. Put a little bit of pressure on the muscles. Make sure there's no bleeding. Yeah. All right. Any questions, Henry?
No current questions.
Well, the alternative surgery for this patient would have been a laminectomy and a fusion. Why don't we show our audience the difference between the Duke laser disc repair and how minimally invasive it is versus a laminectomy and a fusion.
Duke laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Duke laser disc repair. This MRI represents a typical case with L4-5 and L5S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Duke laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Duke laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Duke laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Duke laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Duke laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Duke laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Duke laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-Strips, and a Band-Aid. Total time for the Duke laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Duke laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Duke laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Duke laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Duke laser disc repair's half-inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Duke laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Duke laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Duke laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Duke laser disc repair, there is no damage to the muscles. The Duke laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Duke laser disc repair. Spinal fusions have a high risk for infection. The Duke laser disc repair has a very low risk for infection. In the 7 years the Duke laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Duke laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Duke laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Duke laser disc repair. In fact, most Duke laser disc repair patients experience improved mobility after the surgery. The Duke laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Duke Spine Institute. With the highest published success rate of 95%, the Duke laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
All right, welcome back. We're currently working on the L3-4 disc. We've completed the L4-5. And I was just commenting on how the L4-5 disc, the first one we fixed, had so much more herniation that we were dealing with than this disc. This disc is more collapsed and less herniation. It's an older injury. If you ask me, this disc was injured probably 30 years ago, 40 years ago, easily. And it's more degenerated. But there's less to remove, less to fix. So, laser off. I'm almost done with this disc, and then we're going to move on to our last disc, which will be the L2-3. And I'm alternating between the laser fiber and the grabbers. The grabbers are for pulling out chunks, big chunks of herniation. The laser fiber is for really releasing the herniations and also doing most of the debridement. You can't remove this stuff out of the annulus with the grabbers. It's really the problem with most conventional spine surgeries. They don't use a laser, they don't use an endoscope, therefore they can't do this annular debridement. The annular debridement is the most important part of the surgery. I think we're done.
All right, lights on, please. Thank you.
So we're gonna move on to our last disc in just a moment. I'm going to add some betadine and we're going to clean it out. Why is, okay. Remember, betadine is an antiseptic. Its purpose is to kill any kind of microorganism that could cause an infection in a wound. We've never had an infection in 16 years of doing this surgery. Never had a single infection. And the main reason is honestly because it's so minimally invasive. Plus, we're not putting any metal in the body. Infections tend to occur when you're adding metal. The highest risk of infections in spine surgery is when you go through the back of the patient, back of the neck, back of the back, and when you add metal, and when you have a lot of bleeding, and when you have a lot of time for the surgery to take. So the Duke laser disc repair is fast, there's no bleeding, there's no metal, and the risk of infection therefore is very low for those reasons. We use good sterile technique. I got it. All right, 5, 4, 3, 2, 2, 3. It's our last disc we're gonna fix is L2-3. This is the top disc in the spine that we're fixing in our lower back. We do have to make a small incision. That incision once again is 7 millimeters, a quarter inch. And the reason the incision is 7 millimeters is because, well, that's how wide the tube is that we're using. If the tube was 8 millimeters, we'd make an 8 millimeter incision. Shot. Shot. All right, we're now entering the disc through the tear. Shot. You can see the bones spreading apart. Shot. I'm going to remove this guide wire because at this point it's already guided. It's already done its job. Now Luis has got a job trying to straighten that thing out. All right, we've got the dilator in. So now the dilator becomes the next guide wire for the tube. And the tube is called a tubular retractor. That's what we do the whole surgery through. It looks like a shake straw. Shot. You can see the tip of the tube going into that disc right now. That looks good. All right. Any questions from our audience?
Yes. Their first question comes from Carl on Facebook once more.
Hi, Carl.
And they asked, in your own words, can you give a brief description of the difference between the DLDR and the decompression / discectomy for an L3-4, 4-5, and 5-S1? Thank you.
Sure. So Carl was asking, Dr. Duke, what's the difference between what you're doing here endoscopically, the Duke laser disc repair, versus a laminectomy, a discectomy, decompression? So the laminectomy, discectomy, decompression that Carl's talking about is a standard surgery. It's been done for 100 years. And the problem with the surgery is it requires a larger incision, and the doctor is going to be drilling or removing bones in the back of the spine. You can't see those bones here. But to get to the disc and to get a decompression, they have to take bones and ligaments out. Notice we're not taking any bones and ligaments out. So the surgery that Carl's talking about, the laminectomy and decompression, already is a worse surgery because it's removing natural, normal bones that don't need to be removed. That's why Dr. Cambin invented this transforaminal approach, was to avoid removing normal structures. So that weakens your spine and it increases the likelihood you're going to need a fusion, basically almost to virtually 100%. So what's happening right now is spine surgeons are doing the laminectomy first, the decompression first, and then patients come back a year later and they need the fusion done. So they're getting 2 or 3 or 4 surgeries out of one patient. And the reason they're doing that is to make more money. It's that simple. So all these patients end up needing fusions done, but if you do the discectomy, laminectomy first, then you get 2 or 3 surgeries out of one patient, so you're going to make more money. That's not how we work at Duke Spine. Our belief is to do the best surgery and to do it one time and fix you the first time. So the Duke laser disc repair, number one, doesn't remove any bone or ligament from your spine. It goes around through a natural opening, so therefore it's far better for that reason. Then we're not taking the muscles off your spine like a laminectomy or a discectomy. They're going to peel the muscles off your spine. And you're going to have scar tissue where the muscle used to be because they're going to kill your muscle. That muscle dies. And when it dies, it turns into a big, thick piece of scar tissue. So the decompression you're talking about is going to cause muscle death, scar tissue, bleeding, and spinal instability by removing joints, ligaments, and bones from your spine. The Duke laser disc repair does none of that. There's no bleeding with the Duke laser disc repair. There's no muscle damage. And we're not removing any of the normal structures of your spine. Then on top of that, we're actually fixing the tear in the back of the disc, whereas the laminectomy and discectomy doesn't fix the tear. It leaves it alone. Why? Because the doctors that do that surgery don't know they're supposed to fix the tear. That's something we discovered here at Duke Spine. And that's a more recent discovery, 16 years ago. This laminectomy surgery has been going on for 100 years, and it has nothing to do with fixing the tear. Therefore, you're still going to have back pain. If you have back pain now, it's going to be worse after your decompression surgery, because they're not fixing the source of the back pain, which is the tear. The only surgery in the world that fixes the tear is the Duke laser disc repair. And that's what I'm doing right now with the laser. Great question.
We have another question.
Uh-huh.
This comes from, I believe her name in abbreviations is Tennessee Mountain Girl on YouTube.
All right, Tennessee Mountain Girl, welcome to our live stream.
And they said, Happy New Year. I had a fusion in 2012 at my L5 to S1. In the past year, I have had ESIs that haven't helped. What do you think the possibilities are from that?
Yeah, Tennessee Mountain Girl. The problem you're having is called adjacent segment disease, most likely. So the fusion is causing the disc above to wear out and cause pain. We can fix it with the laser surgery. The problem is if you go back to your other surgeon, they're going to tell you need another fusion, which you don't. And then you're going to keep fusing your spine up. You don't want that. You don't want a lifetime of fusions. The surgeon wants that because that's how they make money. But you don't want that as a patient. So how do you avoid a lifetime of fusions? Don't get a fusion in the first place, number one. But number two, you have this procedure right here. We've saved thousands of patients who would have had a fusion done, but instead they had this done. And there's no adjacent segment disease. You don't come back in a year having another disc with a problem. This is a one and done surgery, as long as you get all the discs that I recommend fixed. So if I look at your MRI and you need 2 discs fixed, I would get both discs fixed. Then you're not going to have to come back ever again. You're not going to have anything else done. Duke Spine Institute truly does cure people's pain, and we do it in a way that they only need one surgery. Sometimes they need their facets treated afterwards, but that's a different story. About 25% of our patients have facet pain after surgery, and we have to fix their facets as well. All right, we're just about done. I got 5 minutes left. Great questions from our audience. Just so you understand, folks, I'm Dr. Duke Majan. I can do all the surgeries that you have done elsewhere. I do fusions, I do laminectomy, I do discectomy. I've been doing it for 26 years. There's no spine surgery that I haven't done or can't do. The reason we do this surgery is that this is the safest, this is the most effective at getting rid of back pain and leg pain, and this is the one that doesn't have any bleeding, This is the one that doesn't need any painkillers after surgery. This is the one with a 1-hour recovery. All other spine surgeries are far worse. The results are worse, the recovery is longer, and the patients develop complications from those other surgeries. Nobody has complications from this surgery. And this doesn't require general anesthesia. You don't have to have a tube down your throat. These patients are being done outpatient, just so you know. This is outpatient surgery. This patient's going to go home in an hour. There's no hospital stay. It's all done right here at Duke Spine Institute in Florida. Hospitals are bad places. That's where you get infections. If you're sick, you go to a hospital. But not when you're having elective back surgery. Just about done. What other questions do we have?
No current questions, but we do have a few comments. And the first one comes from Lars Logistics on YouTube, and they commented, "Happy New Year."
Happy New Year, my friend.
The second comment comes from Carl on Facebook, and he said, "Great description. Your work at Duke Spine Institute is a wonderful thing."
Thank you.
And then we also have another comment from Sammy on YouTube, and they commented, "Great job, doctor."
Thank you very much. Yeah, for those of you who don't know that, I'm a big fusion surgeon. I used to do fusions every day. We have literally hundreds and hundreds of fusions on our YouTube channel. You can go to our YouTube channel at Duke Spine and you can watch any kind of fusion you want to see. Lumbar fusion, neck fusion, back fusion, anterior cervical discectomy and fusion. I don't do artificial discs because they don't work, in my opinion. They pop out. And the doctors that do artificial discs are, unfortunately, they do them because they make a lot of money doing them, because they're owners of the company or they're investors. And the truth is, artificial discs, ever since the first day they were FDA approved in the United States back in like 2002, there's been problems with artificial discs constantly failing. And now they just did a study that showed that if you get an artificial disc, your chance of adjacent segment disease is the same as a fusion. So the whole purpose of artificial discs was to reduce the likelihood of adjacent segment disease, which is when the disc above the fusion or below the fusion wears out and needs surgery. And the artificial disc proponents, the people that were supporting it, were saying, oh yeah, with artificial discs you won't get adjacent segment disease. But then they found out that you do get adjacent segment disease. So, and it's the same rate as a fusion. Anyway, I don't do artificial discs because I think it's a horribly barbaric procedure. It's bloody, it's scar tissue, they fail, they don't work, they pop out. They're a gimmick that doesn't work. And I don't do surgery that doesn't work. That's just that pure and simple. Just about done. Another minute. I'm just cleaning up the back of the disc, the tear, the furthest back part of the tear with the laser and the grabber. We should be done in about a minute. I'm going to come and answer your questions face to face in just a few minutes. So if you have more questions, feel free to type them up and I will come and answer them for you. Our next surgery is going to be another lumbar Duke laser disc repair on a patient who has had back pain for years. And her back pain gets so bad she can't do anything. I can tell you she's a travel agent. She travels with her clients around the world. She travels everywhere, like Iceland and Australia, but she hasn't been able to travel because of her back. So she wants it fixed. She went to the VA system. The VA just did nothing. as the VA is very good at doing, unfortunately. And she got shots. Of course, shots are never going to work to fix your pain. So she knew about Duke Spine and the Duke laser disc repair. She decided to have this surgery done. So that's who our next surgery will be. I think she's a 2-level DLDR, right? All right, we are pretty much done here. Good job, everyone. Yeah. So type your questions up. I'll come answer them for you, face to face. Let me show you real quick the incision. You can see how small it is. We had to make 2 in her case, just because of the way that the disc itself projected to her back. It was not commensurate with doing 1 incision. It really has more to do with the shape of the spine. Usually, because of the nice lordotic curve, we can do 1 incision. But in her case, we had to do 2. All right, we've lost probably, I would say, maybe 2 cc's of blood. That's about 40 drops. I'm going to show you these incisions. Just give me a second. I'm going to apply some pressure first. So we just got through treating L2-3, L3-4, L4-5, 3 discs, 1 surgery, 2 incisions, each incision 1/4 inch, virtually bloodless, no damage to the spine at all, no damage to her body except for the incisions. And let me tell you folks, that kind of an incision, 7mm cut like that, it doesn't really hurt. These people don't need anything afterwards. They literally leave our recovery room in an hour and they're not taking any pain pills. You go to the dermatologist and they cut off a lesion off your skin, their incision is bigger than that. Of course, they don't give you pain medication because you don't need it. So this is a pain medication-free surgery. There's the 2 incisions. You see them, Henry?
Yes, we do.
And we're going to close those up in just a second. Go ahead and type up your questions for me and I'll be right there to answer them. But we're finished with this surgery. Great job, everyone. Ray, take off. All right, I'm here with one of my patients who traveled from Australia to Florida to the Duke Spine Institute for treatment. And you look happy today.
Yeah.
Yeah? Why are you so happy?
I'm happy because my back pain is gone.
Your back pain is
and
gone.
my leg pain is gone
Awesome.
from the disc. Yeah.
From the surgery yesterday.
Surgery yesterday. Yeah.
And you had the Duke laser disc repair.
I had the Duke laser disc repair. Yeah, that's right. Yeah.
So why did you come all the way to Florida from Australia for the Duke laser disc repair?
I've been suffering from back pain and leg pain for nearly a year after an accident. So I did a lot of conservative treatment like physiotherapy, exercise physiology, but it hasn't cured my pain. The pain was chronic, and I've been suffering from a lot of issues, emotional frustrations and things, and sleepless nights. But a couple of neurosurgeons back in Australia has offered me a surgery. They both offered me a fusion, which I don't want to go for. So then I have looked into Dr. Duke. I found Dr. Duke, and he's doing an amazing job doing a laser technology and also doing very minimally invasive procedure. So I thought this is what I wanted, and it's a faster recovery. I could go back and work back within a couple of weeks. So that's why I traveled all the way from Australia to US.
Yeah, and we did your surgery just yesterday evening.
Yeah.
So it's around 12 hours now from
from the surgery, and your pain is gone. And you can see in the video here where we did the laser surgery, we got into your disc endoscopically, and we used the laser to clean the tear in the back of the disc at L5-S1 where their pain was coming from all the inflammation. And now that back pain is gone. And you didn't have to have fusion. You didn't have to go to the hospital. You didn't have to deal with narcotics, right? You said you took a couple of anti-inflammatories and a muscle relaxer yesterday.
Yeah, but I didn't have much pain about with the surgery because it's laparoscopic and minimally invasive, I believe.
Yeah, that's correct. That's correct. So there's not a lot of trauma. There's no scar tissue. There's just a little incision. And of course, we don't remove any bone or ligaments from the spine. It's all done minimally invasive and naturally. So it's a natural healing of the disc. Now, you said just a minute ago you were suffering with a lot of pain and the effects of pain on your psychological well-being. And I know what you do. You're a nurse who helps patients that have behavioral issues, like anxiety, depression, and maybe other things. But you can appreciate how devastating chronic pain can be on people and their loved ones around them.
That's true. Yeah, I completely agree. It not only disturbs you, also your family. That's what I understood. So psychologically, after a few months, I should say, you will have that frustration of chronic pain, and then your behavior start changing towards others as well. And it's not only about you, it's also about your people living around you. That's very important. Yeah.
You came here for a purpose. You got your surgery that you had hoped to do. Now you're going to go back to Australia.
Yeah.
You got a long trip ahead of you coming up. And how do you feel about your experience here at Duke Spine overall?
Oh, it's really good. Staff is really welcoming, and it's spot on, and they receive you with a smile, and which is really great. And my father was telling, it's amazing how he never thought that in American health system, people like the clinicians are like this. So he was treated differently probably before while he lived in US, but it was really amazing, and your staff is really cool. I should say, yeah, they're welcoming. They're good.
Thank you very much.
And you are the best. I
appreciate it. It's an honor to take care of you, and it makes me feel so satisfied to see you happy and out of that pain. So congratulations.
Thank you, doctor.
You're welcome.
Yeah. If you're suffering from back pain, this is a very good cutting-edge technology and very advanced surgery, which Dr. Duke has developed his own, and without minimal, no damage to the bone, no damage to other things, and easily approaching to the disc and removing it. He is very skillful in reaching there without, manipulating any of your muscles or anything. And you can see from me that I have recovered within few hours after the surgery. So I would say if you don't want a long-term complications from the surgery, this is the best surgery you can get done by Dr. Duke here.
Congratulations once again.
Thank you, doctor.
Dr. Arjik Majan here at the Duke Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Duke Spine Institute?
Dr. Duke, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration where I could maybe get up, stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And like I said, I was scared to death.
The problem with pain management, unfortunately, is that it doesn't fix the issue when you have a herniated disc and back pain from a herniated disc, because you need surgery on that disc to repair it. That's what the Duke laser disc repair did. You can actually see here that we went into his disc with the endoscope and we were cleaning out the herniation with the laser. And the laser actually makes a huge difference. People say, oh, lasers, they're not used in spine surgery. I'm Dr. R. Duke Machen here at the Duke Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Duke Spine Institute?
Dr. Duke, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration, where I could maybe get up, like stand for 15, 20 seconds so I could get to the back.
All right, I'm Dr. Duke Machen, and we are finishing up our first surgery of the 2023 year. It is now January 3rd, 2023, and the first surgery was a Duke laser disc repair. This is a patient who had 3 herniated discs in her back, and they were off on that left side. So when you get a herniated disc, it can actually herniate out anywhere. It can go out to the right in the back, it can go off to the right side, it can go out to the front, side, left back, or just straight back. So, you know, a herniated disc can really happen anywhere, but the ones that cause back pain, the ones that cause leg pain, called sciatica or radiculopathy, they happen in a specific location. That location is right here, where the hole is, where the nerve comes out. So this is the left hole, and this is the right hole. And when we're doing this surgery, people either have a herniation on the right or the left, and sometimes they have it on both sides. If they have it on both sides, I've got to go in on both sides and fix it. So this particular patient had a problem with the L4-5, L3-4, L2-3 disc. And I went in on her left side with that tube, and I went in there and I actually cleaned out the tear, cleaned out the herniation, and I expect her back pain to be gone and her leg pain to be completely gone. It went perfect. Couldn't have gone better. We took out some big pieces of herniation at the L4-5 disc. That was the bottom one. That was the worst one if you look at the MRI. And when I got in there and I did the discogram, you could see the dye wrapping around those herniations at L4-5. They were big. And we got those taken care of. So she's waking up right now, and she'll be ready to go in about 30 minutes, go home. This is an outpatient surgery you're watching. We don't go to the hospital. We do this at Duke Spine Institute, our own surgery center. We've been doing it now for 16 years outpatient, and we've never had to bring anybody to the hospital. So it's been a very good procedure. It's very safe, and it fixes the back pain as well as the leg symptoms. Most other types of surgery that people get offered by their surgeon It includes things like laminectomy. Well, when you do a laminectomy, you're actually not even fixing the disc at all. You're just taking part of the bone in the back of the spine out. That's not going to fix a herniated disc. Discectomy doesn't either. Why? Because they're not cleaning out the tear, and it's not allowing the tear to reheal. You need that tear to reheal to get rid of the back pain. All right, we're going to take some questions. Our first question is from...
Our first question comes from SARS Logistics.
SARS Logistics. SARS, S-A-R-S?
S-A-R-S? Yeah, SARS Logistics.
All right, interesting name.
From YouTube, and they asked, well, it's not really a question. I think it's seeking for advice. My doctor wants me to do a bilateral lumbar decompression on the L4-L5. I don't want to do the surgery, but it can be done by lease. I don't have insurance itself pay and cost, please.
All right, SARS Logistics. I got your question. Your doctor is offering you a laminectomy. I guarantee you that is not going to work, and you're going to end up back again with a second surgery called the fusion. And that's a very expensive surgery, the fusion. Doctors don't care for some reason about the patient's plight or your situation. They're incredibly unempathetic, and it really bothers me to no end. But that doctor will do your laminectomy. Laminectomy is done for one purpose, when you only have leg pain. And laminectomy is a terrible solution for leg pain. The laser surgery we just did is the best solution because leg pain comes from a pinching of the nerve from the front, which is the herniation. When you do a laminectomy, they're not even taking the herniation out. So all they're going to do is weaken your spine, and you're going to be back for another surgery called a fusion. You don't want the laminectomy. I promise you it's the worst thing you could do. Self-pay. We take self-pay at Duke Spine. The laser surgery you just saw is the very best. I don't know the pricing. I need to see your MRI. And so we offer a free MRI review where I would look at your MRI, figure out what's wrong, and tell you what my recommendation is. And based on the recommendation, we have pricing. Now, sometimes we tell people you should fix 3 discs, but they can only afford to fix 1. And that's fine. You'd fix the worst one. But the key is with Duke Laser Disc Repair, we're not damaging your spine to cause more instability, which is going to cause the need for more surgery.
All right. Next question. Well, this next question is a comment, and this comes from Sammy on YouTube. And they said, I wish all other doctors learned about the Duke Laser disc repair procedure.
Well, Sammy, the truth is, I was just having a conversation with one of the heads of the entire neurosurgery institution for the United States. And he was very angry that most spine surgeons, including neurosurgeons, are basically in bed with the industry. The industry is the companies that manufacture screws and rods, okay? And the industry makes money every time they put screws and rods in. How much do you think those screws and rods cost? Well, let's just say we go back to the comment that was made earlier by SARS Logistics, the L4-5. SARS Logistics is going to have a laminectomy done. It's going to weaken his spine. Then he's going to come back in 6 months to a year, maybe 2 years. He's going to need another surgery called a fusion. The screws and rods...
Just got to adjust a little. Apologize on that. Yep, there we go.
The screws and rods that are used to do the fusion probably cost the industry maybe $20 to make. However, they'll charge $2,000. So the profit margin is massive for these screws and rods, plates that are put in the spine. When you have a business that makes that much profit and there's millions and millions of surgeries done a year, you're talking about billions of dollars in profits and revenue for these spine industries. They are protecting their investment. They are meeting with surgeons. They are paying surgeons to put in screws, rods, and plates. And we were just talking yesterday about how wrong it is because it's not in the best interest of the patients to have screws, rods, cages, and plates put in. And this neurosurgeon was commenting on how amazing the surgery is that we do because it doesn't require screws, rods, and metal. So it is an issue, but as long as surgeons keep getting paid a lot of money to do implants, metal, and fusions, you're going to have a hard time switching them off of that to a surgery that pays a lot less.
The next question comes from Food is Life and Love on YouTube.
Hi, Food is Life and Love. I enjoy your comments on our YouTube videos.
And they said, Doc, I've had 4 previous microsurgeries with success at the T2 through 3, T8 through 9, and C5 through 6. On all left side, 25 years suffering. I have current issues cervically, 2 levels, opposite sides. I think around 3 through 4 right approach, and 5 through 6 left approach. Having pain, neck pain, shoulders and bicep numbness. It's all tingling bad. Worse when lying on my back, now happening all the time. Need to get help. Gonna send an MRI this week, and I want my life back. Been watching several of your procedures, and I'm hoping you can help. And I see how much you enjoy helping others. This is what gives me confidence. Need my life back, and hoping you can put the task in your hands.
Well, that's quite a comment, and it's more of, you must have spent the whole surgery typing that out, but I like that. Look, the fact is, what we do very well at Duke Spine, number 1, we figure out where the problem is, and number 2, we have the most advanced treatment in the world for it. So when you do your MRI review, I'm going to identify the source of your pain, and then I'll tell you, based on the source, exactly what needs to be done, whether it's Duke laser disc repair or Duke plasma rhizotomy. Duke laser disc repair is for disc problems and disc pain. Duke plasma rhizotomy is for facet problems, facet pain. And 95% of people's spine problems are either disc or facet. So between those 2 procedures at the right levels on the right side of the spine, we can cure pain quite easily. So I look forward to helping you as well.
Next question comes from Sammy Din on YouTube once more, and they ask, do you fix craniocervical instability by the same procedure?
Hey, Sammy Din. Craniocervical instability is a nonsense diagnosis. There's no such thing. It's a diagnosis that chiropractors will give you so that they can treat you and take money from you for months and months on end. Craniocervical instability is nonsense, okay? It's coming from a veteran neurosurgeon. There is no such thing. There is basically very rare cases where people are involved in high-speed motor vehicle accidents where their head, basically their skull, pulls away from their spine. That is the only true case of cranial cervical instability, okay? The rest of it is made up by chiropractors that do motion dynamic x-rays and try to convince patients that they need chiropractic treatment for the rest of their life because of subluxation. Don't buy into it. Your pain is not coming from craniocervical instability. It's coming from either facet joints or discs. And we can cure the pain at Duke Spine Institute with the right treatment.
We have a couple more questions from Food is Life, once more on YouTube. Their next question is, as a side note, in all of your experience, have you ever heard of cervical spine issues causing severe tinnitus?
Yeah, I get asked this question a lot. Cervical spine issues do not cause tinnitus or tinnitus. Tinnitus is ringing in the ears. The most common cause of ringing in the ears is going to be related to a problem with the what's called the labyrinthine system, which is your semicircular canals located in your temporal bone. It is an ear, nose, and throat problem, ENT. It is not coming from the cervical spine. There's a lot of misinformation out there, articles and papers and comments that I'm reading and hearing, but it is absolutely not true. Whenever I fix people's spines in their neck, their tinnitus does not go away. Neurosurgeons are trained to deal with tinnitus, certain types of tinnitus, to diagnose it and to treat it. But the tinnitus that we treat comes from vascular malformations, not anything to do with the spine. I've never seen a patient with tinnitus get better after spine surgery. So I think it's misinformation. I don't believe it. I don't believe tinnitus comes from the spine.
Their next question from Food is Life, they ask, have you heard of Dr. Hai Dongzhou? If so, what is your opinion of him? He did all my surgeries with success. It's just that he won't do multiple levels, different sides at once. I am impressed with your procedures. Wow, the 3-level thoracic did epic.
Thank you. First of all, I appreciate it. Hai Dongzhou sounds like a Korean surgeon. I don't know anything about him. However, I'm a believer in fixing everything with one surgery. I don't believe in spacing it out just to make more money, which is the only real reason they would do that. Patients deserve respect. They should be treated with respect. I treat my patients as if they were me. And what would I want to do for myself? I would never want to have 5 surgeries when I could have 1 surgery to fix all 5 problems. So I don't agree with that philosophy. I think it's wrong. Every time you have surgery, you're putting yourself at risk. Surgery is risk, period. And if you have 5 surgeries, you're taking 5 risks. If you have 1 surgery, you're taking 1 risk. And that's risk of complications, of course. So I would recommend, if you can get it fixed with 1 surgeon at 1 surgery, that's the optimal way to do it.
Second to last question is from Carl on Facebook once more, and I guess it's coming. He's talking about the pain that would come in from both legs, and then he asked, "How do you know it's on both sides?"
Well, if as a surgeon, when I treat my patients and I'm planning their surgery, I always ask them, "Do you have back pain and do you have leg pain? If you have leg pain, is it on both sides or just one side?" So I rely on my patients to tell me which side bothers them in their leg. And if they're saying they have leg pain on both sides, then the next question I have is, well, what's causing the leg pain on both sides? And the most common cause is going to be a pinched nerve in the back from a herniated disc. So I'm going to look at the MRI and I'm going to look for a herniation on the right side. I'm going to look for herniation on the left side. Some people have 2 or 3 herniations on the left side, 2 or 3 on the right side. If that's the case, I'm going to recommend treating all the herniations on both sides. Now, other causes of leg pain include things like piriformis syndrome, which is a torn muscle in the buttock. So I'm going to examine my patient, see if they have a piriformis syndrome before surgery. If they do, we're going to treat that as well, because that can cause leg pain. It has nothing to do with your spine. And then, of course, there's other causes of leg pain like venous hypertension, where the veins dilate with blood. That typically causes burning and aching in the calves. So pinched nerves cause pain that radiates from the lower back down the leg, but venous hypertension causes pain just in the calf. It doesn't radiate down. Piriformis syndrome causes pain that radiates from the buttock down the leg, and they have a tender piriformis muscle on exam. So the physical exam is very important in determining the source of the leg pain. So I don't just rely on the MRI, I rely on a physical exam. That's why when people ask me what I recommend for treatment, I always tell them I need to see your MRI images and I need to do a physical exam. We do those exams virtually these days over the internet. By doing a virtual exam and looking at your MRI, I can usually determine exactly where your back and leg pain is coming from.
Right, and 2 comments left. The first one is from Brian Johnson on Facebook.
Hey, Brian.
And this was talking about pain and people not getting the proper treatment. He added to that, not to mention that the insurance companies determine what is best or not needed for the patient. It is just unbelievable. Wish I can give them the pain and see what their thoughts are on that. Your surgery was the only procedure that worked, and I had over 100 procedures, shots, therapy, surgery, etc.
Yeah, Mr. Johnson, I appreciate your comments and sentiment. You're correct. That's my biggest campaign right now, is teaching people that all these shots, all these stimulators and pumps and laminectomy and discectomy and fusions and artificial discs and all this spine surgery and spine procedures happening is totally unnecessary. You know, I didn't believe that years ago. I thought the insurance companies were just complaining about unnecessary procedures. But then I realized, once I learned how to actually cure people's back pain, that the cure is the laser surgery on the disc and the plasma on the facets when they have facet pain. That all other treatments are completely unnecessary. Shots, totally unnecessary. So there's literally $100 billion a year being spent in the United States on patients like you with treatments that don't work, that don't cure their pain. And that needs to stop. That is a massive campaign. I can't fix this problem myself. I mean, it's so crazy when you think about it. All the money that's being made by doctors, by surgeons, by companies selling epidural steroid medicine, needles, spinal cord stimulator. You know how much a spinal cord stimulator costs? When we buy a spinal cord stimulator to implant it into a patient, we're paying $21,000 for that thing. You're talking about a tiny little battery with a computer in it and a wire. Literally cost that company probably $200 to make it. And they're charging us $21,000. And those things don't even work. And doctors are putting them in patients at record pace right now. Literally, you go to a pain management clinic down the street and you look at the operative schedule for that day, and it's spinal cord stimulator, 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 20 spinal cord stimulators, and they're making $10,000 each profit. That's $200,000 in one day profit on putting spinal cord stimulators in. Profit. Now the total cost is going to be around probably around $35,000 per stimulator. So that's 350 times 2 is $700,000 that the insurance companies like Medicare insurance companies will pay for a spinal cord stimulator one day in a busy pain management clinic. And those things don't even work. They don't even last. People all want them out. It's just criminal what's happening in spine care in the United States. And I'm trying to fix it. I'm trying to change it. But it's impossible to do with just one person. So that's why we do the best we can. We broadcast, we try to educate people, but in the end we need a bigger mouthpiece, a bigger megaphone. We need to get the word out. And I'm spending all my own money doing this. And I don't mind doing that, but you know, it would be nice if other people joined the fight for what's right. And it wasn't cost just borne by me.
Brian said you're the best. Our next our last question comes from Sammy Din. It's a two-part question. Can you recommend me a surgeon who did the same procedure over here in Texas? And if so, how long does it take for the whole procedure? I think from like the paperwork till like out of leaving.
Hi, Sammy. Yeah, there is no other surgeon in Texas that does the Duke laser disc repair. It's only done here in Florida at Duke Spine. We have lots of patients that travel from Texas to Florida to get the surgery done. That's what you're going to need to do. You're going to need to come to Florida in order to have this procedure done. If you want to know what needs to be done and how much it'll cost, I recommend you submit your MRI for us to review. We do a free MRI review. It costs you nothing to do. You go to our website. You can go to mri.dukespine.com and you can fill out the form with some information about where your pain is. Does it go into your right leg, left leg, both legs? You have numbness, tingling, just basic questions like that. And at the end, it's going to ask you to upload your image files. So if you have a CD, you're going to want to sweep those DICOM image files off your CD onto our portal, and that way it uploads into our Google Drive, and we can actually load them onto our PAC system and see them. But if you don't have a CD with your images, try to get one from the MRI center where you got your MRI done. Call them up, ask them for a copy of the CD, and get that CD copy in your own hands and mail it in to us after you submit the form. When you're submitting the form, it gives you a choice to upload your images by sweeping them in to a portal or mail in your CD. It also gives you the opportunity, if your MRI center has a portal themselves, that we can log into. But we need to do your MRI review, come up with a treatment plan, and then just plan on coming to Florida to get it done. All right? There's nobody in Texas that does this.
And that is it.
It's worth it, trust me. We don't have complications. our patients do very well. Their pain is cured. They leave here in an hour. They go back to a normal life. Whenever you go and treat elsewhere, your surgeon has about a 25 to 50% chance of causing a complication during surgery that you have to live with the rest of your life. Whether it's permanent hoarseness, whether it's permanent swallowing problems, whether it's nerve damage, spinal fluid leaks, the list goes on. Infections, pneumonia, heart attack, stroke, blood clots in your leg. All those are real complications that happen all the time with regular spine surgeons and regular spine surgery. We don't have those complications with Duke laser disc repair. So it's not just a matter of picking the safest, the most effective surgery. It's about picking the safest surgery for you to not have a complication. There are people who die from spine surgery all the time, paralyzed from spine surgery, and have 5, 6, 7, 8, 9, 10 spine surgeries in their lifetime or more. Like you just heard from one patient who had 100 surgery procedures. Why do you want to spend your life having procedure after procedure after procedure that doesn't work? Go somewhere to get fixed. That's why you travel to Duke Spine Institute. It's for that purpose. It's not just to have spine surgery. It's to have your life back, and to have it back with one procedure, one surgery done. All right. Thanks for joining us. We'll be back in about 15 minutes for the next surgery.